Where did we go? Okay. Chat. Where did we go? Oh, you have your video off now.
Okay. All right.
Can he still see us? As long as he can see us, we don't have to see ourselves.
Good call.
We are recording.
Mhm.
I think we're good now. You should be able to see.
Okay.
I'm on Facebook.
All right.
Click down on that. Go back to start video. And then click the down on that.
Okay.
I know you got me.
I'm just going to go.
Let's go for it.
Okay, I'd like to thank everyone for joining us this evening. I'm Hart with Medtronic Pelvic Health, and we'd like to thank you for taking the time to join us this evening to learn a little bit more about treatments for bladder control. I'm privileged enough to work with the Kentucky Lake Urological Associates, and I'm joined here tonight by Dr. John Betties and the nurse practitioner Morgan Stone. They treat hundreds of patients for these issues, among many more, and I help them with their bladder control treatment plan. So Dr. Betties has been in practice since 2004 in urology, and Morgan Stone has been a nurse practitioner for 11 years, and 3 of those in urology. So I'd like to turn the talk over to them, and we will be taking questions at the end of the talk. So thanks again for joining us.
All right. Okay, so we're going to be talking about overactive bladder. I'll let Hart. Thank you all for joining us. All right, so 44% of people say that they're embarrassed to talk about bladder control problems, and it's really time that we start to change that. So some of the things that patients will say is, am I ever going to regain control? Can I go out on a date? I have to look for bathrooms wherever. Whenever I'm in a store, I can't go to the grocery store and get through a whole shopping session without having to stop to go to the bathroom. Am I going to be able to get a job? I'm afraid to leave my house. And that the bathroom's always on my mind. So we would like to talk about that and to get that addressed. So we're going to be talking about understanding overactive bladder and bladder control. We talk about our kind of our treatment plan of what's going on in our minds to get you fixed. And then we'll get into some of the treatment options that we offer here and answer questions at the end. So you're not alone. 1 in 6 adults has overactive bladder. It's for males and females. And when you think about the volume of that, that's 37 million in the United States. When you look at diabetes, there's 30 million people that have diabetes. And so overactive bladder is prevalent, and it can lead to significant problems with quality of life, loss of sleep, loss of confidence, self-esteem, poor feelings of general health. So urinary incontinence is not a normal part of aging. A lot of people just say, especially women, they'll say, well, it's just part of aging. It's time for me to start wearing Depends or wearing pads. But what exactly is it? So going more than 8 times a day, having to go right now, can't delay that sensation of, oh, I need to go to the bathroom. planning activities around going to the bathroom, limiting on what you're doing, like you can't go to the movies because you know you're going to have to get up and crawl over people in the movie theater. Using pads to control leaks or changing from regular underwear to disposable underwear. And so your bladder may be talking to you saying, hey, we need to investigate this a little bit more. So how does the bladder control work? So it's kind of a feedback cycle where when your bladder gets full, it sends nerves up to your brain that says, hey, it's time to go to the bathroom. And then your brain sends a signal back to your bladder to say, okay, let's go ahead and go to the bathroom and empty. And so there's a normal process in that. Your kidneys produce urine and that gets to the bladder. When your bladder's full, it's time to empty the tank. So what causes bladder control problems? So we always say what you put in the tank has to come out the tank. So what you eat and drink and medications that you take can affect your bladder. Supplements, pregnancy, childbirth, deliveries, and pelvic floor injuries. All those things can affect that bladder. So there's three main types of bladder control issues. There's stress incontinence. We'll talk about these a little bit more in detail. Urinary retention, which is not being able to empty the bladder, and then overactive bladder. So stress incontinence is the first one. That is the cough, laugh, sneeze leakage, or you pick things up, bend over, and you have urine that leaks out, climbing stairs, working on the job, picking up boxes, carrying groceries in from the grocery store. And sometimes people say, well, I just go all the time so that I can keep my bladder empty so I don't have an accident. So that's stress incontinence, and that's treated differently that this therapy that we're talking about today does not treat. Urinary retention is you have too much in the tank and can't get it out. You can't tell if your bladder's full or you're unable to empty. You may go to the bathroom, but you're unable to empty. You can have a weaker dribbling stream. That's more for men. And then sometimes even needing to use a catheter to empty the bladder. And then overactive bladder, which is what we're going to talk about this evening. So urge incontinence is having loss of bladder control before you reach the bathroom. Frequent leaks, you even drinking small amounts of liquids cause leaks. Or if you're washing your hands or you're in the kitchen and you hear running water and you get that signal of, oh, I need to go right now. Some people also say if they open their garage door or they're putting their hand on the doorknob, getting in the house from going to the grocery store and having that sudden urge of needing to go to the bathroom and having a leak. Then there's just the urgency frequency of gotta go right now. I was just in there, I've got to go back again. And that's the uncontrollable urge, going more than 8 times a day and feeling like your bladder's never empty. So there are treatments to try to get your life back with that. We always talk about the simple, easy stuff. First, we start with just a diagnosis. And a lot of that's just based off of your symptoms of sitting and talking with your provider about your bladder habits and your bowel habits. Then there's lifestyle changes, medications, and then ultimately advanced therapies. So lifestyle changes, what can you do on your own to help your bladder? There's some simple, easy things, dietary changes, exercise, working on those pelvic floor muscles to keep that pelvic floor strong, bladder retraining. There's also just kind of going to the bathroom often on a scheduled time frame so that your bladder doesn't get over full and then it's too late before you can get there. And then Kegel exercises. Those are exercises to strengthen those muscles down in the pelvis. All right. Turn it over to Dr. Betty's.
All right, so thanks for joining us today. At the point at which you're usually seeing the doctor or the urologist, a lot of times you have tried some of these conservative measures, and then we start instituting like the medications and discussing some of the surgical options. But so oral medications are usually the first thing, and they are something to treat your symptoms. They're not really a cure. They do have some side effects that are fairly common: dry mouth, constipation, dry eyes, blurry vision, and sometimes an increase in your blood pressure. And they are sometimes discontinued secondary to these side effects. Advanced therapies is where I feel like our clinic and most urologists really is what we're here to help you understand, and hopefully something that can be utilized for those people who medications don't work for, or people who don't tolerate medications. And those range from this Medtronic InterStim system that you see on the screen there. The scientific term is that's called sacral neuromodulation, and that also includes the neuro system. And we'll talk a little bit more about that in the next upcoming slides, and then Botox injections.
And thanks, Dr. Betty. Just a reminder, if any of you have questions along the way, submit a question, please, through the chat feature on your Zoom link.
So Botox is a paralytic that we inject into the bladder wall. It's similar to medications in the way some of the medications work at providing a decreased squeeze of the bladder when you have that strong urge. They really don't address the communication or what's really some of the input to the bladder that's making it want to squeeze. And there is some side effects just with any other medication that you could even cause too much paralysis and need to catheterize. So the neurosystem is a form of that neuromodulation where the therapy is actually administered into the nerve, as you can see in that person's foot, into what's called the posterior tibial nerve. And it's, again, a training, and it's working more on that sensory input between the bladder and the upper, if you want to think about it like your computer system. And then the InterStim system is another form of the sacral neuromodulation, where it actually is delivering that same type of input to the bladder, closer to the bladder and the nerves that supply the bladder. And it's something that's always present, always running in the background, so you don't have to think about it. It's a therapy that lasts a good amount of time also. So InterStim is typically given or is evaluated in a staged approach. So you would come in and we would discuss with you what InterStim is and what that approach is. And they vary from a small wire placement that's temporary, that we see whether or not you have improvement, to maybe a longer trial period where we place the lead that would eventually be the permanent lead. And that's, you can see on the slide, it says that the tests go from 3 to 14 days. We track your symptoms. Heart is very good at keeping contact with you throughout this trial period. And if we see you've had at least a 50% improvement in your symptoms, then we typically would move on to the permanent implant. So InterStim is safe and effective. 84% of people would say that they were satisfied with the treatment. There's a 3 times greater improvement in the quality of life compared to medications. And 76% of people achieve success compared to 49% with medications. So is the therapy right for you? The typical person, I feel like, is one who has come in, who has tried to reduce, like Morgan mentioned, the dietary changes. So you've reduced your caffeine intake, you've reduced the foods that cause potential for irritation to the bladder, you've done the Kegel exercises, you've tried the bladder training or the time voiding and medications, and none of these seem to be working for you, or you just didn't really tolerate the medications. That's the ideal person, I think, for this therapy. And, the whole goal is to get you back to not having that concern about going out in public and having an accident, just, living a life without a lot of worry about having to find a bathroom, always walking in a place and checking where the bathroom is, and just getting back to a normal life.
Okay, so thank you, Dr. Betties, and thank you, Morgan. I'm going to go now to some questions we have coming in. So I'm just going to toss this out to you guys. And just a reminder, if you have any questions that come up while we're having our discussion, please submit those questions via the chat. Okay, this patient writes, I sometimes have bowel leaks, not just bladder leaks. Does this also work on bowel issues?
I'll let you go more.
Okay. Yes, absolutely. So it is also indicated for fecal incontinence, and that can be anywhere from a large bowel accident to just a little small fecal smear where you say, I've gone to the bathroom, I thought I cleaned myself up, but every time I go back, there's always just a little bit there from a bowel side. So that same nerve that talks to the bladder also talks to the bowel. And so it's very effective for that as well. So even if you just have bowel in itself, it also works. So it's kind of an added bonus for people that have bladder issues, bladder and bowel issues.
Great, thanks. Okay, another question. Do I have to have a referral from my primary care provider, and does insurance pay for this?
So I would say if you're interested, to probably call our office first and ask our receptionists are wonderful about seeing first with your insurance if that's an option with our clinic, if you're in network with our clinic. Most of the time you don't have to have a referral from your primary care, but the girls at the front would let you know that. And then we can go from there. If we decide this is a therapy that's right for you and you want to proceed with the test, then we have our insurance girls that also look at your insurance and discuss all of those things.
Great, thank you. Okay, another one coming in is, do I have to have a test first, or can I just go ahead with the therapy?
So that is the trial period. So we would, all of these require a trial period before you would have the permanent implant.
And is that something that the patients would have to take off work for, like to stay home for a week or two, or?
It's a minor procedure, and you could go back to your normal daily life as soon as it's finished.
Great. One last question, unless any of you have any lingering thoughts. Is this therapy new?
No. Yeah, I'm not sure the exact date when it was available to the public, but it was something that we were trained on, or at least I was trained on in residency, and I'm pretty sure it had been available for several years before that.
Yeah, so I would just say that over the last 20 years, it's just gotten better in terms of the modifications, the size of the device, the way that patients are able to self-manage it at home, and then also the fact that now that they are MRI compatible, where they didn't used to be. So I would just say that it's not new, but it's better than, and they're always improving.
I'm glad you said that. Dr. Betty's here was actually the first urologist, the first surgeon in the state of Tennessee to place one of those leads that allows the patient to be able to have a full body MRI scan with the InterStim system. So that's a new improvement. But yeah, the therapy has been out for over 20 years. Any last questions, attendees? I want to thank you guys again so much for tuning in, and encourage you, if you have more questions and want to talk to individually, to make an appointment with the office. The office number is listed there, and this is just an excellent team. They've provided this type of care and this therapy for hundreds of patients now, and I'm lucky enough to help in that process. So guys, any last thoughts?
No, thanks for
you.
joining.
Okay. Yeah, thanks for joining.
Okay, thanks. You'll have a great night.